But again, so the ratio is about 2 to 3 to 1. So there is a little bit of evidence that females are, to some extent, protected from the development of autism. And we're not really quite sure when it happens. The literature is just starting to emerge. There's something called the female protective effect that Robinson et al. At Harvard is starting to look at. And kind of what they're saying is that you get 2 X chromosomes, so in order for a female to develop autism, you need a greater insult. You need a greater genetic insult, and that's what they found, that there were 1.7 times more genetic variations in the females than the boys, right? And males show higher rates of autism, and the risk of autism was greater for the SIBs of females with autism. So there's a little bit of it, but again, that's one of the only studies that is even looking at that. There are other reasons, in addition to genetics, why this could be true. Testosterone, have you ever heard of the extreme male theory of autism? Right. So boys are exposed to testosterone, more aggression, less pro-social behavior. Females are more exposed to estrogen and oxytocin, which is more nurturing, loving, connection, pro-social behaviors. So there's a bunch of theories. We got the female protective effect, we've got testosterone, we've got oxytocin. And then in general, it's very well recognized that male fetuses are just, more susceptible to problems. They're more vulnerable to infection, they're more vulnerable to stroke, stress, malnutrition, and any of those things can cause problems in males. So there is probably a real relative imbalance in male to female, but is it 8 to 1 or 10 to 1? No, it's probably 2 to 3 to 1. And we are missing them for a bunch of reasons. So again, why are we missing them? I feel like some of this is repetitive, so if you're thinking, okay, you guys can consolidate this, let me know. Again, Clint, they're at Yale, and what they do is they describe the females in autism as research orphans. They're just not there. They are just gone. So that's a problem. They've suggested, not this particular group, but in general, the literature suggests that there may be a female autism phenotype that looks different than the male autism phenotype. And what's going to happen with that is if we don't recognize how the female present differently than the males are going to get diagnosed later. They're not going to get diagnosed till they have a lot more problems, till their autism is a lot more severe, or they have a lot more comorbid conditions like severe anxiety, severe depression, suicidality, severe anorexia, severe eating disorders, severe behavior concerns, things like that. And then finally, and this kind of goes along with it, but I don't know if you've ever heard of diagnostic overshadowing or diagnostic substitution, but that's when the presenting problem is related to the actual problem, but it's not really what it is. So what's happening, Mandy and I think it's Centuria, recently, I think it was 2014 or 15, they did a case series of 10 women with eating disorders and some rigid behaviors. And of these 10 women, one was diagnosed with autism. They reassessed them and they found that actually 7 of them had autism, but the presenting problem was anorexia. So and why is anorexia more common in autism? Because of the OCD, the counting and repetitive and order and weight and need for perfection. So anorexia is a very common presenting problem in women with autism. Okay. So again, other reasons that we are probably not identifying high-functioning women, unless they talk to them about this too. They learn. They're social chameleons sometimes. They more so than males, they tend to watch and mask their behaviors. They kind of learn eye contact. Maybe you look at the center of the forehead, maybe you look at the nose. Sometimes the eye contact is too intense, which is kind of awkward, but it's not absent. And this, again, these are generalities. The opposite could be true. Females, which the literature does show, females tend to have minimal unusual behavior. So you don't see a whole lot of hand slapping or,
And from talking with just different girls that I've seen through the years too, sometimes it's not, they report that it's not so much that they don't have these behaviors, it's that they hide these behaviors well. So they may go to their room at and eat, or take a break and go to the room, and that's where you might see those unusual behaviors. They're just really good at picking out when and where to use them.
They've learned that
They've
that's
learned
socially
that that's
unacceptable, and they respond to that feedback a little bit better than boys. And then finally, the literature does support, and we'll review it very, very quickly, that for females, the restricted interests tend to be fairly typical. They tend to be boy bands, they tend to be fantasy books, Harry Potter, vampires,
Anime.
novels, anime. Anime is very popular. Maybe they're just hair, philosophy. It could be certain boys that the interests are often intense. So this is where you have to clinically really ascertain, okay, well that's a typical interest, that's normal, but is the intensity of it appropriate? And then, is that all you hear about, right?
And typically when we assess these girls, what we'll see too is that that's the repetitive behavior, or that's the repetitiveness of it, is the consistent bringing up of those topics throughout conversation.
Yeah, and they enjoy talking about these topics, and when they do that, their eye contact and gestures are often very good, because that's their topic. And when you try to bring up another topic, you get nada. Yeah, and we're going to show you some examples of that. So the other thing, and we talked about this before, is that comorbidity issues. So females are more passive and internalizing, anxious, depressed. Males are often more aggressive and externalizing. They're, like I said, they're running around the room, punching holes in the wall. They're sometimes, like climbing on the couch, pillows are ripped up. Sometimes the females are described as borderline personality, which you really can't do until they're 18.
And the depression I really see too a lot, and Michelle Garcia Winter talks about this in her book, is that a lot of times it's because you aren't drawn to interact with people, so you isolate yourself a lot. So then due to that not being around people, the depression occurs and it becomes more prevalent. So really, teaching and coaching these young women that, you have to put yourself in those situations so that doesn't happen.
And in the end, there's different perceptions of what's socially acceptable for males and female in terms of social behavior, right? Boys will be boys, it's fine, they're jumping, they're running. Girls are quiet, she's shy, there's really nothing wrong with that. She's playing with the doll. She may be just combing the doll's hair repetitively, but girls play with dolls, it's fine.
And once again, you may see some of those aggressive behaviors, because I know
You can.
there is some at home a lot of times, some other more maybe appropriate or safe places. They're able to pick and choose.
Yeah, so we see that a lot where the teachers are like, no, they're fine, they're great. And the parents say at home, they're like, they come home and they release everything, all the stress from holding in and maintaining that social facade all day. And again, let's see, we'll talk about that. So the DSM-5, I don't know how familiar you are with that, but that's the psychologist diagnostic and statistical manual. It just is effective recently. And really, this is all they say about gender and autism, is that girls with intellectual disability are more likely to get diagnosed with autism. Without intellectual impairment or language delay, they often get unnoticed because they compensate for their functioning a little bit more high. I have the diagnostic criteria there. I don't know that I'm going to go through it. Basic things: deficits in social, emotional reciprocity, so that back and forth on topics that they're not interested in, that you may be interested, is really difficult. Deficits in nonverbal communicative behaviors, and where we see that is integrating eye contact, gestures, and talking at the same time. It's hard to do all three at once. Often you can do two at once. You can do eye contact and gestures, but not talk. So you say, well, and we'll talk about this in the ADAS. I'll show you what I mean. That's really fairly diagnostic. And the deficits in developing and maintaining relationships appropriate to the developmental level. Girls may or may not necessarily have this problem so much, but they tend to fixate on one friend, and they have a problem often with more than one friend at a time, or jealousy of the one friend wants to hang out with another friend. We'll talk about that in a little bit. And the other thing that females we have a problem with, or a lot of people say, oh, that's not really autism, is they have a hard time figuring out where a girl fits in with this repetitive behaviors. Or they're not seeing the repetitive behaviors, or she's not lining up the toys. she maybe is carrying her stuffed animal everywhere, and maybe we don't know that. Maybe the parent didn't report it, maybe the child didn't report it. So what you really need to do an in-depth clinical interview, you really need to talk to teachers, you really need to talk to parents, you really need to see what's going on and get a really good clinical picture in order to make an accurate diagnosis, because it can be easily missed if the behaviors aren't blatantly apparent. Okay, and then this, I don't know how much this makes sense, but kind of the question is, I almost want to call it the evolution of autism. It's like 1980, we didn't really see this, right? And how many of you knew somebody with autism in 1980? No. Why? So again, I was telling you, back in 1952, it was called schizophrenia of childhood or psychosis of childhood. And you had to be fairly impaired. You're rocking, you're nonverbal, things like that.